and internal features of chambers of heart. So in this we discuss the competency, that is external and internal features of each chamber of heart. A cross-sectional cut through the heart reveals three layers, that is superficial layer, epicardium, middle layer, myocardium, and deep layer, that is endocardium. Endocardium is the sheet of epithelium. It lines the heart chambers and makes up the valves of the heart. Myocardium consists of cardiac muscles in a spiral arrangement that squeezes blood through the heart. The cardiac muscle cells branch and join at junctions called as intercalated disc. Each single muscle has a centrally located nucleus. The physiology of the cardiac muscle. Cardiac muscle cells are triggered to contract by flow of calcium ions into the cell. Intercalated discs contain adherents and holds the cells together. There are gap junctions that allow ions to pass easily between the cells. The free movement of ions between cells allows for the direct transmission of an electrical impulse. This impulse signals all the muscle cells to contract at the same time. Right atrium. Internal features. It has three anatomically distinct regions, each of which is remnant of embryological development. Posterior portion of right atrium has smooth wall. Embryologically, it is derived from right horn of sinus venosus. Smooth posterior wall of right atrium receives superior and inferior vena cava and coronary sinus. The wall of anterior portion of right atrium has horizontal parallel ridges of muscle bundles resembling the teeth of the comb called as musculi pectinati. Anterior wall is embryologically derived from primitive atrium. Atrial septum is primarily derived from septum primum and septum secundum. It also contains fossa ovalis, the sinoatrial node and AV node. Coronary sinus. It is located on the posterior side of heart. It receives almost all the deoxygenated blood from the vasculature of the heart. Ostium of the coronary sinus opens into right atrium inferior to the orifice of inferior vena cava. The valve of the inferior vena cava is the eustachian wall. Coronary sinus. The valve of the coronary sinus is the Thebesian wall. It covers the opening of the coronary sinus and prevents backflow. These venous valves insert into a prominent ridge called as sinus septum or eustachian ridge. The ridge separates ostium of the coronary sinus and the inferior vena cava. Interatrial septum has interatrial and interatrioventricular parts. Fossa ovalis is the remnant and is found in the interatrial part of atrial septum. It appears as a central depression surrounded by a muscular ridge called as limbus. Tendon of Todaro. The tendon of Todaro connects the valve of inferior vena cava to the central fibrous body. It courses obliquely within the eustachian ridge and separates fossa ovalis above from coronary sinus below. The tendon is a useful landmark in approximating the location of atrioventricular or AV node. Triangle of Koch. To approximate the location of atrioventricular node or AV node, it is necessary to form a triangle of Koch using lines that cross the os of coronary sinus posteriorly, right atrioventricular opening anteriorly and tendon of Todaro superiorly. So these form the triangle of Koch. Thebesian veins. These are small openings in the endocardial surface of right atrium. These openings are the ostia of smallest cardiac called as Thebesian veins. These veins drain deoxygenated blood from myocardium to empty into the right atrium. Crista terminalis. The smooth and pectinate parts of the right atrium are separated by a ridge called as Crista terminalis. It begins at the junction of right auricle with right atrium and pass inferiorly. It runs inferiorly and parallel to the openings of superior and inferior vena cava. SA node location. Crista terminalis results in a groove on the external surface called as sulcus terminalis. It is a landmark in approximate location of SA node. The intersection of the following lines indicate the position of the SA node. Sulcus terminalis, lateral border of superior vena cava and the superior border of right ventricle. Right auricle, superior border of right auricle. Membranous atrial septum. At the anterior and inferior aspect of atrial septum, the tricuspid valve annulus is attached to the membranous septum. As a result, a portion of the membranous septum lies superior to the annulus and therefore functions as membranous atrium and membranous ventricular septum. Right ventricle. Most of the anterior surface of the heart is found by right ventricle. Trabecular cornea characterize the wall of right ventricle. The outflow part or the infundibulum carries the blood out of the right ventricle. Tricuspid valve. The blood is pumped from right atrium through atrioventricular orifice into the right ventricle. When the right ventricle contracts, blood is prevented from flowing back into right atrium by the atrioventricular valve or tricuspid valve. The valve consists of an annulus, 3 valvular leaflets, 3 papillary muscles and 3 sets of cardiac tendineae. The atrioventricular orifice is reinforced by the annulus fibrosis of the cardiac skeleton. The annulus is attached to the membranous ventricular septum. Tricuspid valve has 3 leaflets, anterior, posterior and septum. Anterior leaflet is large. This forms a partial separation between the inflow and outflow tracts of the right ventricle. The posterior leaflet extends from the lateral free wall and septal leaflet is oval in shape. Papillary muscles contract and tug down on cardiac tendineae attached to the leaflets to secure them in place in preparation for contraction of the ventricle. This is done to prevent prolapse of the leaflets into the atrium. The total surface area of the cusps of the tricuspid valve is approximately twice that of the respective orifice, so that considerable overlap of the leaflets occur when the valves are in closed position. The septal papillary muscles arises from the septal papillary muscle arises the muscular intervertebral septum. This muscle has attachments to anterior septal leaflets. The most affected are the septal leaflet, which has restricted mobility because of extensive cardiac tendineae attachment directly to the myocardium. Septomarginal trabecula. Moderate band muscle bundle extends from interventricular septum to the anterior papillary muscle and contains a component of right bundle branch of the conductor system. The moderated band is the continuation of septal band called as septomarginal trabeculae. Left ventricle. Most of the left lateral surface of the heart is found by left ventricle. Abundant trabecular cornea characterize the wall of the left ventricle. Myocardium of the left ventricle is much thicker. Interventricular septum appears from within left ventricle to bulge into the right ventricle. Left atrium. Atrial appendage is derived from primitive atrium and left atrium is derived from Fetal pulmonary vein. Venous structures are absorbed into the left atrium, resulting in posterolateral connections of right and left pulmonary veins. The pulmonary veins enter the heart as two pairs of veins inserting posteriorly and laterally into the left atrium. Left atrium is found in the midline, posterior to the right atrium. The walls of right atrial appendage are again pectinate. Bicuspid valve. The valve consists of an annulus, two leaflets, two papillary muscles and two sets of chordae tendineae. The atrioventricular orifice is partly reinforced by annulus fibrosus of cardiac skeleton. The annulus fibrosus supports 2/3 of the annulus. The annulus fibrosus supports 2/3 of the annulus. The bicuspid valve has two leaflets, anterior and posterior. The two opposing leaflets of the valve resemble a bishop's hat or mitre. Thus, the bicuspid valve is often referred to as mitral valve. Thank you.